Hello all, myself Murshida Yasmin, Assistant Professor from SNS College of Physiotherapy. In this video, I'm going to talk about anatomy of the knee joint. Let's get into the topic. To define about what is knee joint and how the joint is formed, it is formed by the major bones of the lower limb, in which the femur, thigh bone, the tibia, leg bone, and the patella together forms a joint called knee joint. So the lower end of the thigh bone and the upper end of the leg bone together forms a joint called the tibiofemoral joint. So femur, it is a thigh bone, it is a rounded lower ends, otherwise called as condyles, articulates with the tibia. The tibia is a shin bone. Here is the shin. This is a shin bone, the main weight bearing joint of the lower limb. The entire weight is shifted to the tibia. The patella, it is a kneecap. It is a sesamoid bone embedded in the quadriceps tendon that protects the joint and improves the leverage of the joint. Note the fibula. This one is the fibula. The outer lower leg bone is present, which is present laterally near to the knee, but it is not directly a part of the knee joint. So these bones forms a joint in the lower limb called knee joint. To empathize where there is a need to study about the knee joint in case of the injury to the meniscus or injury to any of the surrounding structures of the knee joint will cause pain, swelling, stiffness, and locking of the knee joint, which is commonly seen in athletes and sudden twisting injuries happening in any kind of persons. So there is a need to know about the anatomy of the knee joint. Then only we can able to classify the condition and also to diagnose and to frame a protocol for the rehabilitation. So this is how we have to empathize why we need to study the knee joint. So cartilage and meniscus, the articular cartilage, which is a smooth tissue covering the ends of the femur and tibia, allowing bones to glide over each other seamlessly. So that articular cartilage will cover the entire knee joint, which will give you a smooth surface to allow the bones to glide over. And menisci, two C-shaped pads of fibrocartilage, which is present medially and laterally on the tibial surface, located between the femur and the tibia in the knee joint. They act as a vital shock absorber and deepens the joint socket for the stability. Usually, the joint socket is not as deep as the meniscus. So it will be like a shallow one. So once the meniscus present, that will deepen the socket so that the femur fits in easily. So the two C-shaped meniscus or the fibrocartilaginous pads that are the important structure which gives you the perfect movement in the knee joint. The ligaments that connects bone to bone, which means the ligaments that connects femur to tibia, and they provide the primary stability to the knee joint are anterior cruciate ligament, posterior cruciate ligament, medial collateral ligament, and lateral collateral ligament. ACL, anterior cruciate ligament, which prevents the tibia from sliding too far forward under the femur, which prevents the tibia anteriorly dislocating from the femur. Posterior cruciate ligament PCL, which prevents the tibia from sliding too far backward, which is the tibia cannot be posteriorly dislocated in the presence of posterior cruciate ligament. And the medial collateral ligament, which prevents the knee from caving inward. So valgus stability will be provided by medial collateral ligament. Lateral collateral ligament LCL, which prevents the knee from bowing outwards, which is varus stability. It is provided by LCL ligament. So these are the major ligaments that gives a primary stability to the knee joint. There are some other ligaments also which are present in the knee joint. Muscles and tendons. Tendons connect muscles to bone, driving the mechanics of the joint. So quadriceps tendon is the major tendon that connects the large thigh muscles called the quadriceps to the sesamoid bone called the patella, which is straightening the leg. The patellar tendon or patellar ligament, which connects the patella to the tibia. So the patellar tendon is not a separate tendon. It is the continuation of the quadriceps tendon. And the hamstring tendon, which is located at the back of the thigh, which is responsible for the bending of the knee, otherwise called as flexion of the knee. So quadriceps tendon and the patellar tendon and hamstring tendon plays a vital role in driving the mechanics of the knee joint. To ideate, think of the knee as a shock absorber system. As I said earlier, tibia is the major weight bearing bone of the lower limb. So the major shock absorption happens in the knee joint. The soft tissues like a meniscus, here is the meniscus, and the bursae around it will reduce the friction so that the shock absorption happens easily. So it helps in weight distribution during the movement. So the entire weight of the body is transmitted through the thigh to the tibia. So it helps in weight distribution during the movement. Meniscus, two fibrocartilaginous structure. As I said, medial meniscus, lateral meniscus. Medial meniscus is a C-shaped one. Lateral meniscus is the O-shaped one, which is not a incomplete one, like a medial meniscus. So it is located between femur and the tibia. So we need to memorize that there are two fibrocartilaginous structures, medial meniscus and lateral meniscus. What is the function of the meniscus? Primarily shock absorption during the weight distribution and the load distribution properly to the lower limb. It improves the joint congruency. As we discussed earlier, the meniscus gives the deepening of the cavity. The meniscus deepens the socket to fit the femur into the tibia. So it improves the joint congruency and the meniscus provides the stability also. Bursae, what is bursae? The fluid-filled sacs that reduce the friction. What are the important bursae that surrounds near the knee joint? Of suprapatellar bursae, prepatellar bursae, infrapatellar bursae. These bursae are the fluid-filled sacs that gives you a major support around the knee joint. So to summarize about what we discussed now, so knee joint, starting from here, knee joint is a complex joint. It's a hinge joint. So most complex articulation, medial weight bearing and rotation control happens here. And the bones of articulation, as I said, tibia, femur, the patella takes part in forming the knee joint. So the proximal end, femur, thigh bone, medial condyle and lateral condyle gives you the smooth articulating surface. Patella is a kneecap, which is a sesamoid bone, which protects and aligns the quadriceps force, and it acts like a pulley. And tibia, it is a shin bone, medial weight bearing bone with a tibial plateau or intercondylar eminence. Here there is a tibial plateau and intercondylar eminence will be there. Between the two condyle, there is a structure called intercondylar eminence. And the patellar ligament, using a tuberosity description. And coming to the ligaments. So there are cruciate ligaments and collateral ligaments. Cruciate ligament, anterior cruciate ligament and posterior cruciate ligament. Collateral ligament, medial collateral ligament and lateral collateral ligament. Cruciate ligaments will prevent the this is the structure of ACL and PCL. This is how it will be. Like it controls the forward gliding and backward gliding. And the collateral ligament, MCL and LCL will provide side to side stability. Meniscus acts as a shock absorber. C-shaped fibrocartilaginous disc, which distributes the load and protects the surfaces. Function and the muscles. So the key muscle groups are quadriceps, which are the extensor of the knee joint. It's the strongest leg extensor. Hamstring, flexor of the knee joint. Leg flexor as well as the rotator of the leg. Movement happens, or the flexion and extension is the major movement. A medial rotation and lateral rotation also happens. Locking and unlocking mechanism also happens here. And the flexion bending, which is a controlled bending, happens with the help of the good extensor. Extension, straightening, primary alignment of the stance. So the controlled extension happens with the help of the hamstring. So this is what we discussed about the knee joint. This is a simple basics about the knee joint. So while studying the knee joint, if you watch this video, you can get a collection of points which is easy to remember during the examination. So hope this video is useful for you. I'll catch you in some other video. Thank you.